So our topic is on paraplegia. Paraplegia is a result of damage to the thoracic, lumbar, or sacral region of the spinal cord, which would be a T1 level or lower. Motor and sensory function is normal in the upper extremities. There's different levels of paraplegia. There can be a complete or incomplete injury. So complete injury is when both sensory and motor function is absent. And incomplete injury is when there is still some sensory or motor function. There's a classification scale. It's called the ASIA scale, which is ASIA A to ASIA E. ASIA A would be complete injury and extremely severe, and ASIA B to ASIA E are all incomplete injuries with different levels of severity. So with spinal cord injury, there are many secondary health issues that arise. For example, there's respiratory issues, decreased sexual function, decreased bone density, pain, depression, obesity, cardiovascular disease, type 2 diabetes, bladder control, depression, muscle spasticity, muscle atrophy, and so on. So there are several different causes of a spinal cord injury. However, the most common causes in Ontario are motor vehicle accidents and unintentional falls. There are other possible causes are medical conditions, work-related injuries, sports, and diving. So it's important for an individual with a spinal cord injury to stay physically active as much as they can, so they can return to active daily living and decrease the chances of developing any of these secondary health issues, such as becoming overweight or obese, which would therefore decrease their chances in developing cardiovascular disease. And it can also help decrease muscle atrophy. And there's also been some research showing that it can help decrease depression in this population. So Sarah's going to talk about our client that we have coming in to see us.
All right, so our client is a 23-year-old female who has an incomplete injury to the T2 segment. So she's classified at ASIA B on the scale. She is 1 year post-injury and has already completed the initial rehab. So she was very active before the injury, and she was at the gym 5 times a week and really enjoys strength training. She was having some difficulty coping with the injury and her inability to complete things that she was once able to do. So she wants to get back into it, to working out and staying healthy and active. She has come to us and we have created a strength, flexibility, and aerobic program for her. The strength exercises we came up with are exercises that don't require much equipment and that she can do at home or do at a regular gym without having to worry about doing transfers to get into machines. So the client is completing 10 to 12 reps for 3 sets starting at a low weight or resistance, and we will gradually progress from here. We do not have access to an arm ergometer or a new step. However, we are incorporating it into our program because the gym she's attending to is available to her.
Okay, so this exercise is going to stimulate a crunch. So we're going to have our arms straight up above our head. We want our arms right in line with our ears. And you're going to scooch forward a little bit on your chair. And you're just going to come straight forward. And you're going to keep your back and your arms in a straight line. You don't want to move your shoulders forward at all. You're going to keep them straight. And you can go down as far as is comfortable and back up. And down. And up. All right. There you go. And just reach your arms up for me and grab up to this. Okay, so arms straight in line with your ears. I'll lock you, hold on, just lock you in here. Okay. And go ahead. Perfect. Right, yeah. You feel that right in your abs there? So 7. Maybe 3 more. 8. 9, and 1 more. 10. Good. Okay, so this is a bicep curl. We're going to do some together. It's 5 pound weight. So you're just gonna rest your hand down on your thigh, and you're gonna keep the top of your arm still, and you're just gonna bring the weight up to your chest and back down. Perfect. Yep. You just want to keep that elbow in the same spot. 3. Just give me 10 of those. Good. 4, 5, 6, 7, 8, 9, and 1 more. 10. Perfect. Okay. Okay, so this exercise is very, very functional for you. It's going to simulate a tricep dip. You're basically just going to have your arms on your armrest of your chair, and you're just going to try to lift yourself up as high as you can. Okay, so you don't have to get too far, just lift yourself up. And this is going to be very functional in any type of transferring movement. You're going to be moving from your chair to somewhere else. So this is very important. Okay, so just arms back on your chair, and just as if you were getting up. And you can just lift yourself a little bit up off of your chair. Perfect, and back down. That's not too hard? No, it's perfect. Okay, so we need 10 of those. 3, 4, good. 5, 6, 7, 8, 9, and 1 more. Perfect. Okay, so the next one we're going to do is oblique twist. So again, we're going to have you scooch up a little bit forward. You're going to have your arms straight up in front of you, both hands on the bungee here, and you're just going to turn your body. You're going to rotate from your trunk. So you're not just moving your shoulders, you want to move your whole trunk. And this is good for your core, so it's good for core stability, any type of movement with your core, which is very important, right? Good, so straight in front of you, and just to the side. Okay. Good? Over here. Again, we're going to lock your wheels so you're not moving. Okay. Okay, so arms straight up in front of you, and you're just going to twist to your left. Perfect. Yep, from your core, so that's 1. Good. So show me 10 of those. Good. You feel that in your obliques there? Good. 6, 7, 8, 9, 10. Good. So you'll do 10 on that side, and then we'll switch you around, and you can do the other side as well. Okay. Okay, so today we're going to be doing back rows. So in your chair, I'm just going to get you to move up a little bit, just so you have some room for your elbows to come back. Okay. You're going to sit straight up, arms straight out in front of you, and you're just going to pull towards you. You want to keep your elbows close to your body, right beside your torso there, right back out, and back, and you're going to feel it right in the middle of your upper back. Okay. Okay. I'm just going to move you over here. Thank you. Facing there. Grab onto these. And yep, just have you scooch up a tiny bit. I'm going to lock your wheels in so you're not sliding around. Okay, and now, yep, so just pull it towards you. Perfect. Keep your elbows in. Good, and I'm going to get you to do 10 reps for me. 3, do you feel that right here? Yeah. Good. 4, 5, 6, good job. 7, 8, 9, 1 more. Good.
Alright, so for our next exercise, we're just going to make this a little more functional. It's just going to involve your upper body, you're just going to involve your arms, and then your core. So although your core is not going to be moving, you still need to contract it in order to keep your upper body stable. So you're going to need a partner for this. So I have Carolina who's going to help me out with this. So basically all we're going to do is you're going to lift the ball over your head, contract your core so you're stable, and you just want to throw her the ball. You can catch it, just bring it back to you, so just catching it, and once again, you're just going to go with that, contract your core, and pass the ball. Okay. And we're just going to do this 10 times.
Okay.
Alright? So we'll have this. I'll lock in, make sure you don't move. And so you're going to contract your core, right? You're going to lift the ball up over, and you're going to pass her the ball. Perfect. And then you catch it, and you're going to pass the ball. Perfect. So 2, 3, 4. Good job. 5, 6, 4 more. 7, 8, 9, 1 more. Good job. Alright, for the next exercise, we're gonna have this, so it's just a string with 2 balls at the end, and it's gonna be a core exercise, okay? So you really want to contract the core. Give it a little bit of space just so I don't hit you. Basically, you just want to get it started, and you're just whipping it around, keeping your core straight, and you just kind of want to get the ball going around, and you'll feel it in your core as you do this. So, we'll just have you try this out. So I'm just going to bring you over here to the space. I'm going to lock you in. You're straight. Okay? I'm just going to okay. Okay? So, yeah, so just try to get it started, and then keep going hands above, and really contract your core. So we're just going to have you do this for about 30 seconds. We'll take a break. How does it feel?
Good?
You feeling your core?
Yes, I do.
Alright. Perfect. Alright, so it's going to be the last exercise that we're going to do today. And it's just going to be for coordination, hand-eye coordination. So I'm going to be your partner for when we do this. I have Carolina as my partner just to demonstrate it. So it's just going to be a little crossball or any like tennis ball or anything like that. So basically she's just going to throw it and you catch it. And you can throw it back. It's just
One hand, catch it with one hand.
yeah, try to do it one hand, just hand-eye coordination. Okay. Catch it. You can use your good hand to throw back. And just going to be opposite hands just for the coordination.
Okay.
Okay? So just going to try this. So just toss it. Good job. Perfect. There you go. So you're going to do about 10 of these. One more. Perfect.
All right, so after properly transferring your patient onto a bed or a flat surface for stretching, we're going to incorporate flexibility into our program. This is very important because these individuals will end up having muscle spasms or contractures, which is a reduced range of motion in the joint due to chronic shortening of the muscle. So the first one that we're going to do is going to be stretching the quad and the hamstring. So what you're going to do, you're going to grab the patient's leg, just right underneath the knee, have hold of the foot, and you're going to press the leg towards the body, giving a nice stretch, holding for about 15 to 30 seconds, and then releasing. And you're going to complete that on both sides, about 2 to 3 sets, just so you can get the elasticity in the muscles back. All right, so we're going to stretch out the hips for now. Just because they're in the seated position the whole time, we want to increase that range of motion for them. So similar to the last stretch, we're going to hold underneath their knee and hold the top of their foot. In that controlled motion, you're going to move your hand on top of the knee, pushing back, and then opening up the hip, and coming back to start position. So again, slow controlled motion. We're going to do this for about 10 to 12 times on each side, and then switch legs.
For the next flexibility component, we're going to be working on the chest. Since they are sitting in a chair for majority of the time, there's possibility for a tight chest, and that can lead to poor posture. So what we're going to be doing, we're going to instruct our client just to sit up a little bit. We're going to be using a small ball, placing it in the back, and while we're holding the chair, we're going to get them to lean back, having a straight back, and we're going to instruct them to put their hands towards their head. And what we're going to do as a trainer, we're going to grab the elbows and gently pull back. So here we're working on an upright position, and also having their chest straight out. And you can hold this for 10 to 20 seconds. Usually you can do it 1 or 2 times. So our final stretching component is going to be an upper body strength that we're targeting the triceps. So what we're going to do, we're going to instruct our client to reach behind their head as far as they can, and we're going to add some pressure just right here. So what we'll be doing, we'll be holding this stretch from 20 to 30 seconds, doing it 2 to 3 times. And once you've done that one, you'll go to the next side, instruct them to go slowly, as far as they can, and you're just going to add some pressure here. So you're going to have one hand on their elbow, and then the other hand on their back, like on their hand that's on their